Dr. Google is probably our biggest challenge as healthcare professionals right now. And there are some great sites out there. Unfortunately, they rarely pop up first on your Google searches. One of the things that we see people do on a regular basis is they'll get a medication, and instead of talking to their pharmacist about it or reading the information that's usually provided on a new prescription, patient education monograph, things like that, which provides clear, balanced, unbiased information, they'll go to Google. One of the things you'll notice about Google, if you type the name of your drug in there, almost without exception, the top 300 hits are going to be negative, talking about, oh, don't take this drug, and have you had this side effect? Well, I'm the first one to admit that side effects are an issue with medications. In fact, when I went to school, we had drug interactions drilled into us. We had to worry about these interactions between these many different drugs that people were taking, and we had to watch out for that. And adverse reactions due to medications were not ignored, but they weren't as intensely put upon us as the interactions were. Well, after I graduated and started practicing, within my first year, I quickly discovered that my drug interaction problem was about 1/10 what they said it was going to be, but my adverse drug reaction was 10 times what they told me it was going to be. So like I said, I'm the first one to admit that we have to watch out for adverse drug reactions when we're giving these people medications, and interactions are very, very important. But there has to be an inherent trust and understanding that doctors and pharmacists are not there to cause you harm. That's not what we're trying to do. We're not in cahoots with Big Pharma. That's not what we do. A doctor does not receive a check every time he writes a prescription, nor does a pharmacist receive a check every time he fills one. Having that paranoia should be in the realm of the conspiracy theorists, because really practitioners are there to help you. They're there to make you feel better. They're not there to cause harm.